Greetings and welcome to In Depth. I'm Dike Rostant. We recently had a conversation about caring for persons with dementia. Now we build that conversation out to a more general issue of caregiving for the elderly. To do that, Care Safety Solutions Limited founder and managing director Asha Mungal joins us now. Greetings, Ms. Mungal. Thank you so much for joining us. Care Safety Solutions Limited. Give us an overview.
Hi, Dike. Thank you for having me. So, a basic overview, Care Safety Solutions. We provide geriatric care for our elderly persons, but we also provide care for persons who may have done surgery. So, the age limit varies once you need some level of care after health conditions may have deteriorated a bit. But our core business is built around our seniors.
And what is the gap that was identified? Or let me ask it a little differently. If Care Safety Solutions is the answer, what is the question?
Who should we go to care for our senior loved ones? So then the answer would be Care Safety Solutions Limited.
And is this something that you've been working on for a while? Is it that you're on your own or employed by someone else? What is the draw? Because sometimes people will say, okay, I may want to get into healthcare, but I don't necessarily want to deal with the elderly. So why that specific grouping, even though you said you do more than just the elderly?
The business started because of my mom. So as an only child, we initially started with the panic button, and that kind of spilled over into the caregivers, spilled over into meals for seniors, spilled over into the support group. So we have different tiers of support where it comes to caring for a loved one. Our bulk of clients are the elderly, but we have a personal reason behind this business because we do have an aging population, both locally and internationally. And we too, at one point in time, we will become, and require that level of care. So where, as I went along taking care of my mom, I saw that there were gaps, huge gaps actually. And as I said, one thing just kind of led to the other. And here we are today.
But how do you go about doing that though? Because it's one thing to say, okay, well, yes, you're taking care of your mom, you have an idea what it is she likes to eat, or if you're going with her to another healthcare service provider, you're finding out what she should and should not eat, the times that she would like to go to bed, whatever. So you know about your mom. But in terms of like finding out and building that capacity to be able to deal with more persons, what kind of training are you going through? And did you need to look and say, well, okay, these people are giving this sort of lessons, they're training this, they're giving this certificate. What's that process like for somebody who may be where you were originally, just caring for their loved one?
Well, I think the best knowledge that I got was actually having that hands-on experience and understanding it from all levels, because it's one thing to do the physical caring. Now, she was only ailing very late in her life. And it was a matter of 3 months, and then that was it. But being an only child, the support of not having siblings, when she has to go to doctor appointments, when her diet needs to be managed, and you realize certain things changing, you have to be, I guess as an only child, you had to be monitoring a lot more than if you had a lot of siblings around and everybody kind of pitching in. But the geriatric care, nurses aid, RNs, it's the same level of care, but you go in just like with doctors, you have your specialties that you would prefer. Where it came to caring for the seniors specifically, I guess as a child growing up, I was always drawn to having older persons around me. And the information, the knowledge that you learn from them, it's really, it's amazing. The stories that they would tell you. And I mean, they have set the foundation for us today. So I wanted to be able to not only take care of my mom, but also give persons that support that they need, the family members who are trying to take care of their loved one. And I used to write an article on self-care for family caregivers, and that was really my avenue to cope. And from that is where the whole request for the agency side came. It gave birth to itself. I would be lying if I said I consciously sat down and decided on what's the next step and what's the next step. The only thing I consciously did was to say, okay, the panic button, this is what we're going with.
And you're talking this and you're talking my language because I am a granny boy. But
Oh,
in
you
terms of that
are.
self-care for caregivers, how important is that? And what forms, how does it articulate itself? How does it manifest?
Ah. It is critical for both types of caregivers, the family and the professional. You are often thrown into that moment where you get the phone call. So we use, for example, mom just fell. Okay, so you rush home. You realize now that, okay, she's complaining of, pains in the hip or the leg. We fast forward, we reach to the hospital. Fast forward, we have surgery. Fast forward, she's being discharged. Fast forward, she's back home. And now you're like, okay, what's how I'm working? I have no siblings, or if I have siblings, they don't live in the country. What am I going to do? Where do I go? Who do I talk to? There's so many elements of unknown that, and on top of it, what makes it worse, the emotions, because you just mentioned you're a granny boy. So your world is going to be spiraling out of control, trying to do what is best for your grandmother. And once you are carrying that family caregiver role, it is so important to be able to step back. But Dike, to be honest, it is the hardest thing to do. Because being in this profession, I can tell you, as much as I consciously made decisions to, um, Asha, you need to step back, you need to take a breath, you need to have a moment. You do and you try to get out of the house, but then you're constantly like, okay, what's happening? What's she doing? Even though you may have caregivers there. But you need to give yourself that downtime. It's something that you have to practice and work very hard to do. And from the professional standpoint, a lot of our ladies, they have their families and then they leave to come take care of our families. So they really do not get a downtime. So it's important to find something, whether it's music, whether it's just, going for a walk, anything, whether it's a 2 minutes, a 20 seconds that is yours, that you could claim for yourself, is very critical.
And I'm going to be a little morbid and carry it to a conclusion. We have about a minute before the break. What do you do when the chapter closes on the life of that person that you are giving care to? And I'm thinking specifically a family member, because as a professional caregiver, you may be reassigned, even though you may be feeling whatever feelings, but you still may be, when you're reassigned, you still have another person in your charge. That person you've been taking care of, they've taken up so much of your time as you've just itemized. What do you do when you have all this time and all these memories? How do you start to deal with it? And I ask the question because October is also Mental Health Awareness Month.
Oh, where do you start? There's no real place to start. Um, you continue to do what you have to do. You continue to embrace the breakdowns. You continue to embrace the thoughts of, did I do enough? Could I have done better? Maybe I should have done this. Maybe I could have done that. And you go through this roller coaster of emotions, highs, lows. You're walking around, tears just rolling down your face. You're in public and you're trying to cope. Um, you just need to allow yourself to be in that moment, because I can tell you personally, I thank God. I mean, unfortunately, people are going to probably cringe when I say this, but thank God for COVID, because the face mask helped me, because I'm walking through the mall and tears are streaming down my face when you least expect it, not thinking about anything. I went to pay a bill and just tears, 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 tears. You just need to be in the moment. allow yourself to just feel whatever it is, the good, the bad, the ugly. Um, that's basically the first step. And everybody deals with things differently in their own timing. You may be perfectly fine 6 months after, a year after, and then all of a sudden, bam, it hits you. But allow yourself to feel. That is the best part of this whole journey, your recovery, and just take it in stride.
And thank you so much for that. What we're going to take in stride now is a short break. We are speaking about Care Safety Solutions Limited with founder Asha Mungal. Stay with us. We return with more. Welcome back. Dike Rostant here with you. We're speaking with Asha Mungal, the founder of Care Safety Solutions Limited, a TNT-based allied health services provider delivering a holistic approach. And one of the things I want to ask about, please, Ms. Mungal, is where are your services available? Is it that it's for localized clientele, east, south, north? Is it the entirety of Trinidad and Tobago? We're going further into the region. Where can people avail themselves of your services?
We have caregivers throughout Trinidad presently, so east, west, north, south. We're not in Tobago as yet, and not up the islands as yet, but work in progress. But right now, we do have caregivers that we would send to do in-home care throughout Trinidad.
And I think you're also doing some sensitization, some sensitization initiatives. What is that thing that if it's just one thing you want someone to take away in terms of caring for the elderly, caring for a senior, what would that thing be?
It would be to be gentle on yourself. There is no one way to do this, and you can only do the best that you can do. You can't do beyond that. And just give yourself that space to care, and allow yourself to feel the emotions and embrace the emotions. Enjoy the moments of having that privilege to take care of your loved one, especially if it's a parent.
And I really appreciate the way that you would have framed that, because sometimes you look at it a little differently, and then that brings us a different sort of energy with it. But in terms of sharing that insight and knowledge, there are other things that are going on in terms of the Knowledge Caravan, CSSL Corner, the Caregivers Conference and Expo. I don't know if you want to take me through them 3 toot bagay, or let's deal with them incrementally. Your call.
Okay, so on the 28th of October, Saturday, 28th of October, we have our 2nd annual Family Caregivers Conference and Expo at the Center of Excellence. This is significantly built around family caregivers, but also the professional caregivers, where we have exhibitors with their products, their services in this field, all in one place where you can come and learn about what is there out there to help you care. And even if you're not already doing it, it's something that you should know. It's good information for yourself, because we never know when that time comes around, even for our own self. There's information. You may have to go for surgery. You may require a rental of a hospital bed. There are other products to help you with regards to physiotherapy. These are a vital information. And this is in significance of November being National Family Caregivers Month, which is celebrated worldwide. The key is to really have it as close to the time as possible. Where the Knowledge Caravan is, so that is one day where everyone is in a space where you can come and learn and meet and mingle and get a feel and appreciation of what is out there. The Knowledge Caravan, we're going into corporate to be able to educate employees. And it's a twofold approach, because employers often complain about my employees staying home because they always have to be taking their mother to the doctor. The caregiver didn't come out to work, and it's a host of things. But it's also to sensitize employers about some of the other challenges if they themselves have not faced it. But to educate public to be able to start the questions, am I ready to take care of my mom? Do I have finances in place? Do I have a space in my home if I have to bring her home? So it's really to start that process where we can ask the critical questions and not end up like a lot of the time when clients call me and they are smack dab in the middle, pulling out their hair, screaming, crying, and just don't know where to go. So we really want to be that support mechanism where we can guide persons, and have them ask the questions, which also spills into our Family Caregivers Guide, which is a free publication that we are giving out to the public, again, guiding persons into how to, where doctors have shared stories talking about different topics, where persons who have cared for a loved one is giving that advice on the self-care and their journey. And we also have our discount card. It's so many things going on, Dike, that my objective is just to be able to give back, keep giving back to Trinbagonians where they are not feeling so lost. Because I can tell you, me being in this field, when I had to take care of my mom and emotions are involved, good sense goes out the door very quickly. And I often had to pull myself back. And I embraced that moment and that feeling of how lost I felt. And I still had contact with doctors and persons at my fingertips, so I had advantages. So can you imagine when you don't have those advantages? It's really a scary place to be. And I really want to be able, we, the team, wants to be able to give back, just keep giving back so much that we can help persons better care for their loved one.
And finally, just before we go, give us that contact information so people can reach out to you, find out what is going on with the caravan, how they can be a part of the conference and expo, and that contact information. Thank you.
Okay, so they can reach us on 351-CARE. So that's 351-2273. They can call or WhatsApp, or they can email Care Safety Solutions Limited, spelled out, at gmail.com. You can go onto our social media platforms, CSSL, Care Safety Solutions Limited. If you just Google it, it comes up. And, be free. Feel free to ask the questions. Feel free to, it doesn't matter what question it is, because I'm sure a lot of people have different scenarios they're dealing with. And once we can help, once we can answer, we've done our part.
And we want to thank you for doing your part, Asha Mungal, founder of CSSL, Care Safety Solutions Limited. And on behalf of the entire news team, this has been In Depth with me, Dike Rostant. Thank you so much for joining us.